is in the midline, and then it rotates towards the left side. So the left side becomes anterior and the right side becomes posterior. Right atrium in front of the left atrium, right ventricle in front of the left ventricle. Now we come to the left side. The blood comes to the heart from the lung through pulmonary veins. There are 4 pulmonary veins. These are the pulmonary veins which are bringing blood, oxygenated blood towards the left atrium. This is the left atrium. Left atrium has got 4 pulmonary veins, and just behind the left atrium is the oblique sinus. It's a folding of the pericardium. Oblique sinus. Oblique sinus is over here, and behind the oblique sinus is the esophagus. This is the esophagus. If there is enlargement of the oblique sinus, if there is enlargement of the left atrium, this may press on the esophagus, and the patient may have difficulty in swallowing. And this indentation may be visible on barium swallow. So that is the left atrium. The left atrium has got an appendage, which is the rough part of it. This is the left atrial appendage or left auricle. So this is left auricle, and then we come to from the left atrium, the blood goes to the left ventricle. I'll open up the left ventricle again. This is the left ventricle. The valve between the left atrium and the left ventricle has got 2 cusps. This is known as the bicuspid valve. This is bicuspid valve. One over here, the other one over here. The inside of the left atrium is almost similar. It has got a number of ridges, and these are papillary muscles, and they send chordae tendineae, and these chordae tendineae are attached to the cusp. And if they break away due to any reasons, the cusp may not close completely, and there will be incompetence. The left atrial wall is much thicker than the right one, and the left atrial cavity is a bigger one and encroaches on the left side, on the right side. It's a much bigger cavity, much bigger pump. It has to pump the blood all throughout the body. The right ventricle only pumps the blood into the lungs. The left ventricle pumps the blood to all parts of the human body. So the left ventricle is much thicker, much more stronger as compared to the right ventricle. So that's the bicuspid valve. From the left ventricle, the blood goes into the aorta. These are the 3 seminal valves of the aorta. That's the aorta. So when the left ventricle contracts, this valve opens up, aortic valve, and the blood flows into the aorta, and this one closes. During ventricular systole, the mitral valve will close, the aortic valve will open, and the blood will flow into the aorta. So that's the left ventricle. Now on the surface of the heart, you see the coronary vessels. That's the aorta. There is one coronary vessels over here. this is right coronary artery. The right coronary artery, there are three cusps of the aortic valve as you saw it inside. The right coronary artery arises from the anterior cusp and then follows the atrioventricular groove. Follows atrioventricular groove. It gives branches to the ventricle, to the atria, and then it gives a marginal branch at the border between the anterior surface and the inferior surface, marginal branch, and then it continues posteriorly in the interventricular groove and gets anastomosis between the arteries coming from the left side. So this is right coronary artery. Right coronary artery is coming from the anterior aortic cusp or a sinus. Sinus is the slight dilatation over here of the aorta and supplying a major part of the right ventricle, some part of the left ventricle, almost whole of the right atrium, part of the inferior surface, and going and supplying ventricles behind. It also gives a branch to the sinoatrial node. So that is the right coronary artery. The left coronary artery is seen over here. You can't see the left coronary artery because it comes behind the pulmonary artery, and it comes out from here, and it arises from the left posterior cusp of the aorta. Left posterior cusp. Right coronary artery is from the anterior cusp. This arises from the left posterior cusp, and then as soon as it comes out, it divides into two. This is the circumflex branch, and this is the anterior interventricular artery, anterior interventricular artery, also known as anterior descending artery. It goes right up to the apex, anterior interventricular artery, and then circumflex artery goes behind posteriorly and runs between the interventricular groove and anastomosis with the branches of the right coronary artery. So that is the left coronary artery having circumflex branch, anterior descending or anterior interventricular branch, and this is the right coronary artery. And they have got a very wide anastomosis between the two of them. So that is we are left with the venous sinuses. This is one venous drainage system, that's the other sinus system, and they open up in the coronary sinus. This is coronary sinus opening. This is middle, that's the great cardiac vein coming over here, small cardiac vein and middle cardiac vein, all joining into the coronary sinus, opening up into the right atrium. There are other smaller veins which may directly open up into the chambers of the heart. This is aorta, and you can see the branches going from the into the neck, and this is the pulmonary trunk. Pulmonary trunk dividing into the left and the right pulmonary arteries, aorta, arch of the aorta, giving, this is right brachiocephalic artery, which will divide higher up into the right common carotid and right subclavian. This is the left common carotid and this is the left subclavian. And then this will become descending thoracic aorta. So, and this is pulmonary trunk, and that's the superior vena cava. So that completes the surface of the heart. Thank you.